Hello, my name is Erin Hurst, and I am a nurse practitioner student at Auburn University. And my healthcare resolution is improving end-of-life discussions through continuing education. There are many problems associated with end-of-life discussions that can be found in literature. First and foremost is the lack of completed advanced directives and patient-level knowledge. In 2013, research was conducted in Maryland to assess the need for changes to healthcare laws regarding advanced directives. 60% of individuals stated that they wanted their end-of-life wishes respected. However, less than one-third of these individuals had actually completed advanced directives or shared their wishes with their families. Many individuals have noted a preference to die at home or in hospice as opposed to in the hospital. While dying at home or in hospice has been related to decreased healthcare resource use, longer survival times, improved family relationships, better quality of death and dying, and decreased caregiver burnout, hospital deaths continue to far outpace the preferred death at home or in hospice, mostly due to the lack of advanced directives or end-of-life discussions with families. Early end-of-life discussions have been shown to be preferred by patients and families as it allows for a less traumatic experience at the time of death. Although these early discussions are preferred, most do not occur until late in the disease process, when there is no further treatment available. Additionally, those that do have early discussions often report that the frequency or scope of such conversations do not meet their needs. Lack of continuing education of healthcare providers is the biggest issue with this end-of-life discussion problem. Currently, most states do not require formal education for the end-of-life discussions or advanced directive planning for either initial or relicensure for advanced practice nurses. And the Centers for Medicare and Medicaid Services do not require any continuing education in order to be reimbursed for services rendered regarding end-of-life discussions. As such, many primary care providers may not have the knowledge, skill, or comfort level to have effective discussions and may not feel that it is their responsibility to bring up such topics. In a 2017 study, only 68% of primary care providers reported that it was their responsibility to initiate end-of-life discussions, with the remaining providers feeling that it was the responsibility of the patient or other healthcare providers. The proposed healthcare resolution is to require continuing education for all advanced practice healthcare providers, focusing on the quality of discussions with patients, as well as the strategies to educate patients to improve completion of advanced directives in order to be eligible for reimbursement by Medicare. The objectives of this resolution are to increase the number of end-of-life discussions with patients and families, increase the number of completed advanced directives, and to raise awareness about end-of-life options. This educational program will help increase the healthcare providers' skills and comfort level with the end-of-life discussions, as well as educate healthcare providers on populations that may need additional resources. This proposed resolution falls in line with the recommendations from the 2015 Institute of Medicine report, Dying in America, which called for the development of standards and quality metrics for communications and advanced care planning between primary care providers and patients, improved clinical training requirements for palliative care, including end-of-life discussions, and extensive efforts to improve public information availability on end-of-life decisions and the right to choose a personal end-of-life treatment plan. The primary target audience of this video are the Florida State and House representatives. This proposed healthcare resolution is targeted at Medicare. As this is a federal program, it will need federal support from lawmakers to enact change. Secondary target audiences include national associations such as the American Medical Association and the American Association of Nurse Practitioners. If these groups were to support the proposed healthcare resolution, it may increase the likelihood of meaningful change occurring. Finally, the tertiary target audience is the Florida Board of Nursing. This is because if the proposed healthcare resolution fails at the federal level, the State Board of Nursing can institute continuing education requirements for advanced practice registered nurses in order to be relicensed or initially licensed. The educational program is the largest required resource. There are various educational programs already prepared that could be purchased for use. However, a specific educational program could also be created if it is found that a suitable option is not available. There will be an initial high upfront cost associated with the purchase or creation of an educational program, as well as the communication of the need to complete this required education to primary care providers. However, much of this cost can be recovered by the providers themselves when they pay to access the educational program, much like the current system in place for registered nurses to complete their continuing education for relicensure. Additionally, health insurance companies stand to generate great savings as nearly 25% of all lifetime healthcare expenses are incurred during an individual's last year of life. with much of this care not falling in line with patients' preferences for end-of-life treatment. By improving the quality and consistency of end-of-life discussions, healthcare resource usage could decrease. As Medicare currently reimburses healthcare providers for end-of-life discussions during annual physicals, these reimbursements could be tied to an outcome measure, much like the HCAHPS in the hospital setting. For this resolution, a primary care provider is rated by patients on their ability to have such discussions, as well as the percentage of their patients that have completed advanced directives. Thank you very much.